I want to read for you a quote from the back cover of John Maxwell's book called Failing Forward. He says, the difference between average people and achieving people is their perception of and response to failure. As a sleep dentist, you are probably very, very familiar with failure because one of the most difficult tasks in building a sleep practice is building a referral network with physicians, pulmonologists, cardiologists, primary cares, ENTs. It can be an incredibly aggravating process because a lot of times those medical professionals do not want dentists sort of driving in their lane, in their perspective. You should be focusing on teeth. Let them handle the medical side of things, particularly obstructive sleep apnea. Both you and I know, as I've said in other videos, that you are one of the most qualified people to recognize the anatomical indicators and even make the recommendation that a person pursue treatment for obstructive sleep apnea, whether they need CPAP or whether they need oral appliance therapy. That is left up to, obviously, the medical doctors by law. So what you can do, what can you do to overcome that failure that you're going to be encountering constantly when trying to build that referral network with MDs? You need to have leverage in those conversations. Obviously, it's going to require a lot of your time or a lot of your sleep coordinator's time or whoever you've hired, yourself or someone else, to go out and build those relationships. So you don't want to go into those conversations empty-handed because that's where you're going to experience the most failure. And even by the own recognition of this book existing, failure is inevitable, but you need to respond well to it. But another thing you can do is you can have leverage going into that to prevent more failure. And that leverage is having a system in place where you have people reaching out to you on a consistent and predictable basis about treating obstructive sleep apnea through oral appliance therapy. Now, if you don't have that system in place, that's fine. That's something that we can discuss. If you look in the description of this video, I can provide a link where you can schedule a call with us and we can discuss that. But I want to get into a little detail about what that conversation might look like if you had a predictable system in place where people were reaching out to you on a monthly basis with predictability for obstructive sleep apnea treatment and management through oral appliance therapy. If you had that process in place, if you had complete control over the number of opportunities you had to treat people with obstructive sleep apnea every single month, you could go into those conversations something like this. Ring, ring, ring. But you can call the office. Hey, can I speak with Dr. So-and-so? Or may I leave a message for Dr. So-and-so? If you want to go into the office and in person, same thing. Can I speak with Dr. So-and-so? I have X number of people, 60, 70, 80 people between 60 and 80 people reaching out to me every single month looking for an alternative to CPAP through oral appliance therapy. Now, obviously, all of the patients that are coming to me are not going to qualify for oral appliance therapy because of their level of severity of obstructive sleep apnea. So I need to partner with an office, someone that I can trust to send these patients to. Is that something that you would like to discuss in the future? That is leverage. That is when you can start building a significant referral network when you can approach conversations with that level of leverage. So if you think that conversation or having that kind of in your back pocket, going into those conversations could help you, what I want you to do is also in the description of this video, I will place a link to a training that we have created on every single step you need to take to implement yourself that system to have a predictable flow of sleep appliance patients or obstructive sleep apnea patients reaching out to you every single month in your dental practice. That way you can go into those conversations having leverage. So what I want you to do in the immediate, if you're not scheduling a call with us, at least watch that training video so that you can understand how to get that system in place. And literally after watching that video, you could have sleep patients calling your office within 48 hours if you implement everything that I teach you in that video. So I hope this was helpful. Hopefully it shed a little light on how you could encounter less failure in building your sleep referral network as a sleep dentist.